My name is Melinda Mabbitt, and I work at SDSU as an instructional designer. Go Jacks! And I live here in Brookings. Been here 8 years now, actually. So I'm a Wyoming transplant. So I sometimes joke I'm a Wyoming girl in a South Dakota world, but I do love it here. So yeah, adopted jackrabbit. I was actually experiencing a lot of heartburn, and we're talking years worth of heartburn. I was taking over-the-counter things, and that was helping. And then at one point, that stopped helping, and I was nervous because it says you can only take it for a couple of weeks. So I mentioned it to my doctor, and she said, well, we could send you over to Dr. Marquin, and she could have a look. And I was a little nervous at first, so I said no. I started chewing gum, everything, just trying to keep that acid reflux down, and I finally just had enough. And I just sent her a message and said, can you please send me a referral to Dr. Marquin? So it was just kind of a last, I can't do it anymore type of situation. It's the acid from your stomach literally coming up into your esophagus, and it's not supposed to be there. And so the lining of the esophagus is not meant to handle that kind of acid, and so it's burning constantly. I would be doubled over in pain sometimes just because it felt like it was acid literally coming up into my throat. And I would get kind of embarrassed because I was always chewing gum. Even, I'd at least have a thing of gum on the side of my cheek when I was even talking with people on D2L issues. And so it just got to the point where it was really embarrassing and really debilitating because there were days where nothing helped and I would just sit there in misery all day. So first, she ordered the esophagram, which is the x-ray that they take of your esophagus just to see about how you're swallowing. It's like a swallow test, I guess. From there, they determined that I had mild to moderate acid reflux. And so to just double check and make sure that there was no damage from that, that's when they ordered the EGD, which is where they stick a camera down your throat and just look through there and get a visual of the stomach and the esophagus and most of the upper intestinal or upper digestive tract. I think it's the unknown and not having control. That was the biggest thing. And then, of course, with the background of hearing about all these people getting abdominal surgeries, the Princess of Wales, and then having Toby Keith close to death at that point from stomach cancer, your mind just immediately goes to all the negative. But the unknown is scary if it continues to be the unknown. And so I just realized it was something that needed to be done for my health and for the benefit of my family to get it done. So I think I got off lucky just because I didn't have to do all the things, but they did have me swallow, I can't remember the liquid, but they have you swallow this very chalky substance. It's almost like watered down chalk dust. And then what they did from there is they took x-rays of different positions I was in. Then they were gonna give me these things that were crystals that were in the similar type of thing as the liquid. And those were like really bad versions of Pop Rocks, but I didn't need to get those. So that was a blessing. They could see the reflux right away. It was a bit surreal, actually, in a good way, because from the time I saw Dr. Marquin to the time of the procedure, it was less than 20 days. I actually went back and counted. And so it happened quickly, but in a good way. But I just remember everybody being very kind and understanding. This wasn't my first surgery, but anytime they're talking about going down into your mouth and down into your stomach, you get a little nervous about that. So it was nervous and surreal, but all in a good way. Wonderful. I've had a couple of procedures here, but this one I remember very distinctly because they have to put this thing in your mouth to keep your mouth open, and it kind of feels like one of those games, where you have to have your mouth spread open and you say, I think it's called What Did You Say or something, where they spread your mouth out. So they did that, but then I remember a nurse grabbing a hold of my hand because I think I was shaking, either I was cold or just nervous, and the entire time of the process of putting me under, she was holding my hand the whole time. And so that really comforted me to just know they saw me as a human being and not just as another patient, and that helped a lot. So I'm usually really groggy when I come out of any kind of sedation, so hopefully I didn't say anything that was weird or unusual. But for the most part, it was just, we're here to help you. We want you to be comfortable. We want you to feel better, because of the type of procedure. They wanted to make sure I could swallow, that things would be digested okay, so they made sure I had any of the foods that I wanted that were offered. And then they answered all my husband's questions. I didn't feel like I was being pushed out of the room at all. Sometimes you hear these horror stories about bigger hospitals where they're saying, we need this bed now. I didn't get any of that. It was a bit alarming. They did find a polyp that they tested, and that came back benign. So for me, it's just an extended period of antacids, not over the counter, but prescription medicine for that. And so far, that's been working really well. I've only had a few episodes where I've had to deal with acid reflux. So it's better than every day, all day. I loved her. I only met her a couple of times. I met her and then the procedure occurred. So you have to trust a person when they say, we're going to put a camera down your throat. And I trusted her instantly. She was very knowledgeable. She answered all of my questions. I'm sure stayed longer in the room when I was asking all the questions than she probably usually does. But just very compassionate and caring and empathetic as to what was happening to me. I loved her. She was great. Just that they saw me as a human being. They didn't see me as just patient A, B, C, D. It was Melinda Mavitt, here for a procedure, clearly very nervous, a mother, a wife, and we're just going to treat her to the best of our abilities. And that's what they did. They did a wonderful job. Don't get nervous. I can speak from experience. I don't like being told you have to have this or this, and the unknown is scary. But again, the unknown will remain scary unless you get the treatment. And so if you've been struggling and suffering with acid reflux for no apparent reason, you really need to get in and see somebody like Dr. Marquin, because they're going to help you figure out what's happening. I think a lot of people dismiss small town hospitals. I was born in a small town hospital. My children were born in small town hospitals. Our youngest was born here in Brookings. And so I've just always had wonderful care here. I know if it's over their head because they're a smaller hospital, they will let me know if they need to send me to Sioux Falls. I trust the doctors here just like I would trust any doctor from Mayo or any other Johns Hopkins, because they've done their work and they know what they're doing and they care. Because it's close to home, you hear these people saying, oh, I'm just gonna go to Sioux Falls for this or that, and I kind of wanna raise my hand and say, but they can do that here. And it's simple. If it's a simple procedure, why travel and have to then travel back after you've probably had a procedure that isn't very fun? So yeah, I think that being close to home, knowing the doctors, they're in your community. I know my primary care provider goes to my church. I see actually my physical therapist there too. So I know these individuals. They're more than just my doctors. They're my friends. They're my sometimes colleagues, and so I just trust them. And again, why go through a procedure that you're already going to be miserable for and then have to travel 45 minutes to an hour to get home and then get settled again, when you can go straight from here to your home, settle in, and start the healing process.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.